Do you have joint pain or an injury and want to avoid surgery or steroid injections? A doctor in Austin, Texas specializes in an innovative and effective treatment used to help patients with musculoskeletal pain related to sports injuries, arthritis, and accidents.
Bradley D. Fullerton, MD, and this is my practice, ProloAustin.
PRP. Have you ever heard of it? If you haven't, Dr. Bradley D. Fullerton is here to introduce it.
PRP is short for platelet-rich plasma, so it's using your own blood to stimulate repair. So you draw some blood and you spin it in a centrifuge to concentrate the platelets in a layer of plasma, and that's what you re-inject in tissue to stimulate repair.
Dr. Fullerton uses an ultrasound machine to look at tendons, ligaments, and soft tissue to help find the site of injury.
The ultrasound is a non-invasive way of imaging, and it's with sound waves. So the sound waves go in, bounce off tissue, come back to the probe.
Sometimes MRI results come back negative. An ultrasound machine is able to look at soft tissue to see damage a MRI can't see.
You get much higher resolution than MRI, so you can see smaller tears, smaller degenerative changes, and then it's dynamic.
Dr. Fullerton draws blood just like a simple blood draw from a lab. The centrifuge then removes the red blood cells and the plasma component. The concentrated growth factors are then re-injected back into the injured site. Many wonder how many injections they will receive.
My goal is always to do one. You need months to see what one treatment will do. So I spend a lot of time evaluating exactly which tissues are the weak tissues, which are not always the painful ones, and then do one treatment session, and then we follow up at 3 months.
A PRP session takes a little more time than your typical doctor appointment. Just how long do they last?
Patients are here for me about an hour and a half.
In many cases, surgery can be avoided, and other treatments are available to help heal an assortment of musculoskeletal injuries. Dr. Fullerton uses his passion for finding solutions for his patients and never stops mastering the art of PRP. With Daily Rx News, I'm Shelby Cullinan.